Unlock the path to healing with Exposed podcast. Join us as therapists from around the world break mental health taboos, share powerful stories, and provide insights that transform lives. Tune in, educate, and thrive.
In general, what I find in my practice is most of the challenges that people are having is around just navigating life, just trying to just live the best you can. And it's not they present in a way where you could say major depression, general anxiety disorder, social anxiety. You could give them all these labels, but at the end of the day, when you're actually listening to them, it's just that they don't know where to go in life. They're not where they thought they would be, or there's some things that are pressing upon them that they don't know how to get under.
Welcome to Expose podcast. Please help me to welcome Dr. Tiffany Smith. She is a functional psychiatric nurse practitioner and the founder of Aroma Functional Nutrition Psychiatry. Inspired by her husband's journey recovering from chronic combat pain and PTSD, Dr. Tiffany Smith transitioned from traditional Western medicine to a holistic approach, focusing on functional medicine and nutrition. Her practice helps patients from around the world address the root causes of their mental and physical health challenges through personalized treatment plans that incorporate lifestyle changes, coaching, nutrition, consulting, and natural supplements. Dr. Smith is also the creator of mental health resuscitation program. It's a program dedicated to empowering individuals to take control of their health beyond just medication. She is passionate about spreading the message that true wellness stems from daily choices and plans to share her expertise through this upcoming podcast. Thank you, Dr. Tiffany. I'm so glad you are here. How are you?
I am good, and thank you for having me. I'm so excited to be here today.
We are excited, and could you share with us what made you to be on this journey of doing all what I just mentioned, and there's probably so much more to it.
Yes, it was actually working with my husband. Um, you know, my family and his family are relatively healthy, so we really hadn't been in the healthcare system much. However, we both work in the healthcare system. He was a medic in the Army and then advanced into being a nurse in the Army, and he's a combat veteran at that. And then I am a nurse practitioner. And he had started to have some debilitating chronic pain that kind of stemmed for many years. And we were leaning into the healthcare system, but we weren't getting any improved quality of life. As the years went on and we looked back, actually the quality of life was not improving and we were doing everything that they said. And so it was just offering us a bunch of pills and potions, but no true living. And it got to a point where my husband said, no more Western medicine. And that's when we had to figure out what were we going to do next. And in that, we started to realize all of the different modalities that were out there that were not based on a pill or invasive procedure or had a lot of negative effects. And so with him, we implemented the name of the company, aromatherapy, functional medicine, and mental health and well-being. And that's what got him on his journey to wellness. And while I was working with him, I saw that the same need was needed in my practice. And so I created this practice around that personalization and root cause treatment to help with people, not only with mental health, but also I have a component of just overall wellness because our minds and bodies are connected. And I also add a DNA component so people can learn how they work. And we can take the trial and error out of how we should be, how our body responds, and what to do to be healthy.
Would you share any, it could be tips or just ways how you help your husband to recover from PTSD and chronic pain using that functional medicine? If we can go more into details for someone who might have a chronic pain and is listening to it, and many times they
Right.
cannot sleep, they cannot eat, there is this constant.
Correct. So the thing is, the first thing is you have to burn out the fire, get rid of the fire. And the fire was the pain, right? If you have pain, that kind of stops everything. And so that's where actually the aromatherapy came in. He didn't want to take anything by mouth. He didn't want anything invasive. And so when I came across essential oils, no one could really explain the proper way of using them. So I ended up going back to school, getting a degree in aromatherapy. I am an aromatherapist. And in that, you do case studies and you try different blends. And so I did all of these things with him. And we were able to find blends that help with his pain, and not just any pain. Like your bone pain is different than maybe your muscular pain or your nerve pain. And so we had all of these different blends combating his pain. And that was one of the first steps for us. And then he started to get up. He was kind of bedbound from the pain, and he started to get up. He was out and started to engaging with the family. So then the next thing was, now that you're up, we have to do things so you don't have to go back down. And so what we ended up doing was leaning into functional medicine and lifestyle medicine that helps you actually treat the dysfunction within the body. And it helps you also look at your lifestyle and how you can optimize your health naturally. And so that's where we started to focus on diet, nutrition, sleep, our environment, and starting to make things more healthy, less toxic, consuming things that worked for our bodies and didn't, go a negative way, like all the fast foods and things like that. And that's when we started to see even more benefits in his journey. And I can say now, well, let's say back then I was concerned about the walks on the beach, the Disney trip, all of these things. And now we're having those experiences. We're living our lives the way we had destined to live it before, that we thought was stolen from us. So first it was getting rid of the fire, and we used aromatherapy to do that. And I named the company Aroma Functional Nutrition Psychiatry because one, it piques your interest, right? What is that all about? And the thing is that these were the modalities that worked for us, but it also serves as a symbol that there's a modality that works for you. So maybe that's hiking, maybe that's Reiki, maybe that's massage, maybe it's homeopathy. But here we want to help you find you and help you get back to yourself. And that's the whole goal, by whatever works for you. So we're not pushing our modalities, we're listening to you and helping you find yourself in your health and wellness. And that's what the uniqueness of our name means. We want to help you find those 3 or 4 things that works for you.
Thank you for sharing that. And I find it amazing how love can inspire us and inspire you to make the whole degree, because you were like, oh, they didn't taught me at the medical school.
Right.
I'm going to, and I'm glad there are places you can learn that. And for those who are listening and maybe, you know, my partner has the stage 4 cancer and he has a lot of pain in his belly. So there's this chronic pain. Are there any, and I believe, cancer is something many people are experiencing
Mhm.
nowadays. Is there some tips would you like to share around the aromatherapy? Which oils are, I mean, if we can, yeah, can we name those oils? Those,
Tell me what you use. Tell me what you use.
right.
Well,
I mean, there's no quick fix, but,
right.
is there like, are you allowed to share? Yeah.
Sure. So Number one, I want to say in regards to this podcast that it in no way serves as medical advice or a
Right.
doctor-patient relationship. This is just information only. But when it comes to aromatherapy, it can be very individualized because you know how sometimes you can smell something and it triggers a loving response. Sometimes you can smell something and it can trigger an adverse response. So when working in aromatherapy in particular, you want to make sure that there are scents and fragrances that trigger the response that you want. So I can make you a blend for pain, and I think it smells amazing and it's invigorating for me, but you may not stand it. It could trigger some other things for you. However, to answer your question, some oils to look out for in regards to pain would be black pepper, rosemary, lavender, and juniper berry. Those are some ones that are really good with pain. And with aromatherapy, it's all about understanding the chemical combinations in the oils, their therapeutic benefits, and matching them and blending them in a certain kind of way. And so when I was in school, it was like, okay, you can blend some things and they can be better than a narcotic pain medicine. And in that way, it was for my husband because he got up. He would, out of a 0 out of 10 pain, he would say he's a 20. And so for this to help him, he was totally amazed. So it's about experimenting, but I do recommend number one, getting proper education around it because it just because it may be natural and from the earth, it doesn't mean that there's toxicity levels, that there aren't contraindications to use. And that's what no one was telling me when I was learning about essential oils. And you go on the internet and you get a bunch of information. So really having proper information. I went to a school that was accredited with the state, like you can get a student loan for this degree. So it was legit, not somebody's opinion, but actually approved through the government. So that satisfied my need as far as proper authority in learning from an accredited place. Um, if you're at home and experimenting with essential oils, you want to do what's called a patch test. And that's where you can take the oil and you put it like in the crook of your elbow just to be sure that you don't get any allergic reaction and let it be there for 24, 48 hours, even up to 72 hours, just to be sure you don't have any sensitivity to a particular oil. And you always want to dilute an oil so that it's too concentrate. The oils are concentrate. So you need some sort of a sweet almond, a coconut oil, fractionated coconut oil, something like that, because you only need a couple drops and you can put that in a tablespoon and that's it. So you have to always dilute your oils. So those are some tips around aromatherapy that are important for safety and understanding, making sure you work with an aromatherapist if you're not seeking the education but need help. Make sure that you have someone that's been trained in an organization, an institution, and that can further advise you in the best way.
Those has been like years of your study now in a nutshell. But thank you. I'm so glad there's something like the podcast. Is there anything else you want to share also around
Yeah.
that? Mhm.
Mental health in general, what I find in my practice is most of the challenges that people are having is around just navigating life, just trying to just live the best you can. And it's not they present in a way where you could say major depression, general anxiety disorder, social anxiety. You could give them all these labels, but at the end of the day, when you're actually listening to them, it's just that they don't know where to go in life. They're not where they thought they would be, or there's some things that are pressing upon them that they don't know how to get under. And that's to me all around life navigation. So I want to just give a couple tips around how to kind of weed through that, how to get back to you and be the best you can be. And the first thing is listening to yourself. In life, sometimes we can make bad decisions. We could say, oh, I knew that and I didn't respond. And you may question trusting yourself. But I want you to build that relationship with yourself as far as when your body says something, when you have a thought that you can identify and discern you in that and can trust what you feel, having that gut feeling, trusting that gut feeling. That's kind of what I'm talking about. You can call it a lot of things, but just trusting yourself. And that's the first thing, because then now you're trusting yourself and it's guiding you to the best decisions. You have to also accept what it's telling you. So you may be in a relationship, and that relationship, in your gut, you're feeling some kind of way, um, good or bad. But let's say it's a negative thing, because that's hard in a relationship. You have a negative thing, and maybe you're saying, this isn't right, something's going on, and you ignore it. What I'm calling you out to do is address it, face it, so that later on it won't have it as, the more you avoid it, the bigger it's going to get and the harder it's going to be to deal with. And what I'm saying is, face those things that your gut's telling you and deal with it, so that that navigation in life can be a little bit easier, even if it's something hard right now. Two, you want to start tracking yourself, journaling about yourself. So what that means is, it's going to depend on what your gut's telling you about your health and well-being, but it may be tracking your sleep, tracking what you eat, tracking how you feel, tracking the people around you and how they make you feel. You may want to track your resting heart rate. How many times are your bowels moving? What's the color of your urine? Things like that. When you're happy, when you're sad, and all of these things, because you want to get to know yourself in an objective way. And what that means is not just I think, but this is the data. My smartwatch says that I sleep very well. I get all my deep sleep. My resting heart rate is 65, those sorts of things. And so if you have an issue, you're able to communicate that to your providers in an intelligent way. And now you're having a shared decision-making process with your providers. You're able to advocate for yourself when you're working with your providers to get a better outcome. And you want a provider that is your partner, not your dictator. You know your body better than anybody else. So it helps you identify things. And so the next thing is, when you track yourself, you identify those things that make you feel good, that make you happy, and those things that don't. And so one thing is, you want to get rid of those things that no longer serves you. You want to get rid of those things that don't bring you joy, happiness, move you forward. And that, again, your gut's going to be pointing those things out to you. And you want to surround yourself with love, with joy, with happiness. And that can be things as simple as the color of your walls, the clothes that you wear, how you wear your hair, changing the thoughts about yourself to more positive thoughts, getting rid of those thoughts that do not uphold you. So you want to get rid of things that don't serve you, because when life happens, you need all of that to support you and lift you up when you go through life. And when you have those negative things, they just are like hammering at you and putting you down. And that's not what you need when you have stress on top of that. And anything that you do that makes you happy, let's say you sing, you hike, those sorts of things, you want to lean into them more when life is stressful. You want to turn the volume up on everything that makes you feel good when life is pressing down on you to help you get through. Okay, so we talked about tracking, we talked about listening to yourself, getting rid of things that no longer serve you. I had another point around when you're journaling. Okay, running checks. So running checks on yourself. So let's say you tracked yourself, you're really familiar with kind of how you roll, how things go, and you feel kind of off. You're gaining weight, for example. Maybe you're feeling achy. You run checks. So now you know the things that make you feel good, make you feel happy. Well, am I drinking enough water? Did I do the walks this week? Did I do my workouts? What's my stress level been lately? How have I been feeling? And for women, am I coming on my period? Is it PMS? You know, um, what am I eating, lately? Where's my energy level built? This is running checks. It's just like with your car, right? You get a diagnostic, you run checks on all of these systems, and then you turn up and do whatever it is that has been lacking, right? You do those things, and then it's like you're doing first aid. You're triaging yourself, and then you're giving yourself some first aid to to address those immediate things. And then you're going to see what's left. After you've done what you can do, are you still in crisis? Do you need to see a provider? Do you need to just hang out with your friends more? Where are you at with what you need next? What is your body telling you? And then you lean into those resources to help support you after that. And I think if you follow those tips, that's really going to help you to get in alignment with yourself, help you feel calm, and be able to hear where and what you should do and be happy. What do you think about that?
You mentioned something about the natural supplements in your holistic treatment plans and
hmm
integrating it with patient recovery journey. Would you like to add?
So, what I actually add is a functional genomics. And that's where I actually look at your DNA, which tells me how your body works. So, let's say, for example, the rave is the keto diet, right? But maybe you can't manage the fat content. Your body doesn't process it or digest it or has some sort of ill effect to taking in a lot of fat and low carbs. And so it doesn't work for you. And that's why there's no one size fits all when it comes to wellness. And so what you have to do is find a diet plan that works based on how you work. Find the ways to exercise that based on how you exercise. How do you process your nutrition? And so that's where we get to that personalization is through the DNA functional genomics. And it's functional genomics because we're understanding how your body functions and that nothing's wrong with how your body functions, but with the goals that you have in life or how it may be affecting your life, we have to approach it a certain way to get the results you want. And so when it comes to, for example, mental health in particular, you can look at how the brain may clear out dopamine quickly. So you don't really stay in a reward situation. You're looking for the next fix because you're not sustaining that fulfillment of feeling rewarded, for example. And understanding that can help in your treatment and how you look at life and how we can make sure that we can stabilize and normalize your dopamine because now you're not always seeking that next reward, that next dopamine hit, but we can stabilize it based on how your DNA is. Also, prevention. So I had a client come to me who felt like he had ADHD. He says, my dad has ADHD. I can't sleep. I'm up all night. I can't stay on task. I'm just everywhere, scattered. I think I have ADHD too, and I want to be put on medications. So I did the functional genomics testing and identified that in his DNA, mentally, he's fine. His problem was that he wasn't detoxing properly. And his lack of being able to detox reflected the symptoms that are similar to ADHD. And by doing that test, it saved him a lifetime of not having to be on stimulants. And then you adjust the stimulants, you add a new one. They're never going to work because it's not the problem, right? It's not the root cause. Then on top of that, the side effects, not being able to sleep, not having an appetite, all of these other issues around it. And so by getting to the root cause, you take all of that trial and error out and you get to feeling better sooner and living your life.
Wow. And I'm, so curious about the test. Is there like you can later send me the link to your website and how people can they run the test even when they don't live in your state, or how does it work?
Actually, yes. So the functional genomics test that I have actually is now approved with insurance. So most insurances will cover it. You will just have a copay. And I have a network of providers around the US and Canada that wherever I'm not licensed, like where I wouldn't do it. So I have other providers that can. And what the insurance would cover is the test. It'll cover the lab testing as well, the lab reading the results. It'll cover the provider giving you the results as well. So it's all in one package that can be covered through your insurance. So I'll provide you the link that people can go and apply for it. You'll pay a copay, you'll get the test, It'll be submitted to insurance, and then it's a spit test. You just spit in it, and the test kit will come to you, and you'll send it back to the lab. And in about 4 weeks, you'll get the results. A provider will go over everything with you, and now you're going to have this knowledge about you, so you know how to be healthy for you.
Well, I love all what you are sharing, it comes like, from the place of being so aware where you are and just making your life better and that quality, um, which it's accessible. I did never heard about that test. I'm so happy to share it with my friends. And but what else? What else would you like to share? There's, you have this mental health resuscitation program, which, excuse me, my Polish accent makes it difficult to. But
Resuscitation. So it's a mental resuscitation, and that's actually coming soon.
okay.
So the mental resuscitation is just that, we can get kind of mucked up in our brains and just don't feel like we can think properly or figure certain things out. And it's kind of like therapy in a course. It helps you kind of look at your thoughts, look at what's important to you, really break down things such as judgment of yourself, looking at your ego and id, how they break out with Freud, all of these ways that you look at things yourself and others. And it kind of helps clear that up and get you some clarity around your thoughts and how you think, because that's where everything begins. So if we start with clearing the thoughts, then it helps you move forward in your body, in your life. It trickles down into everything you touch. So that's really often the first part. So when I talk about that life navigation, I'm often spending time with clients just talking and having a conversation about what's important to them and where they are. And in that conversation, they kind of get a shift or a epiphany or something. And now they feel better and know the direction to go in. And they don't need medication. They just needed that perspective or shift. And that's what helped them. And so the course helps you do that. So because I can't see everybody, that's a way for you to kind of get that shift you need, that perspective to help you navigate life.
And having somebody there to, sometimes help you shift that perspective, it can be really done by having somebody there, I feel like.
I agree. And so with that, I'm also contemplating having like a Q&A or kind of like a doctor's in type of option to check um, in regards to that, or at least given an option where we can have a conversation. Because you can do it yourself or, have options to work through it and do it with me.
Um, was there, I also read about, how do you see the role of uh, perinatal mental health care evolving?
Oh, wow. It's becoming more of a conversation. We have, so perinatal mental health is the mental health um, from conception through 2 years of birth of a child is the time frame that they say uh, prenatal mental health care. And this population is very they they don't have enough awareness around them. And one, when you're pregnant, you can't take a lot of medications. And then after the child is born and you're breastfeeding, there's limitations in medications. So there's a higher probability that they can have psychosis, other mental health conditions, and they're going to present differently than the general population. Sometimes some of the things you may hear is like, maybe you're being overprotective. Maybe you're being overly cautious, but that can be panic attacks and anxiety that the mom is having, that someone's kind of downplaying it. So we really have to check in with our moms and have an open conversation. There's a lot of assumptions around motherhood that doesn't allow the conversation of mom's mental health to even be had. It's assumed that you're happy about the pregnancy. It's assumed that you are going to have a vaginal delivery and not a C-section. It's assumed that you're going to manage everything. It's assumed that you're going to be okay and you'll be able to take care of your family and you'll be all right. But what if I'm not all right? And sometimes there's no space for mom to say, I need help too. And that can put extra burden on her not having that space. So there's a lot of things around that. And let me say, when it comes to this perinatal mental health, while we talk about mom, dad's experience perinatal mental health issues, even adoptive parents can experience some mental health conditions during that time of child rearing as well. So it and also there's not a lot of research around uh, trans men having children and chest feeding versus breastfeeding. These are new concepts coming about, but they all need support and love. And then also there's that whole loss of a child and support that's needed as well. So I think that there's more conversations. I work with Postpartum Support International, and the website is postpartum.net, where you can find resources in your area. There's chapters everywhere. They serve all of these different situations that people can be in around their child rearing days that they may have. So that's a network that I definitely highlight and support in my practice. I've been trained in perinatal mental health care. And then of course with my functional approach, it works well because it's not medication first. It's getting to the root cause and supporting mom during those times and helping families understand what to look for.
Yeah. I'm new to that, totally to that, the word. So that's why I was like, how to pronounce it? Perinatal mental, even though, the perinatal, it exists in psychology, but there's so many gaps I can see, even, breastfeeding, chest feeding, all of that, which we are just, starting
Hmm.
talking about. And it
Yeah,
feels like we're not talking enough.
we aren't, but the conversations are being had. They're increasing. Let's say that. And this is one of them.
Yeah. And I would be happy to add that link you mentioned. Uh,
Hmm.
would you like to add anything around mental health and food? Like, is there a way to heal depression or mental issues with certain foods or supplements or
Yeah.
oils together? Or the holistic view, your holistic view. Dr.
Exactly.
Tiffany,
So
holistic
with
view.
Exactly. So when it comes to mental health, it's all of that. It's everything. Mental health is everything, and everything is mental health. So your sleeping is your mental health. The job you have is your mental health. So when it comes to nutrition and supplements and all of that, it goes back to having those functional tests, the DNA test, to really know what's best for you. So where maybe melatonin works for someone else, it may not work for you because the issue that you have in your body is different. It's not that you're not producing enough melatonin, it may be something else. The stress could be affecting the production of serotonin and melatonin. And we must first address the serotonin, address the stress, which will affect your hormones and throw you all out of whack. So when it comes to so when you're looking at mental health, you're looking at everything I've discussed, everything around you, everything you see. The color of your walls is mental health. The job you have is your mental health. How you feel in your clothes is mental health, because it all starts mentally, right? And then it goes from there. So nutrition, supplements, I recommend everything, all of those things, but based on you.
Thank you, Dr. Tiffany. Is there anything else would you like to share, or otherwise I have one more question, but I'm just checking out.
Let's do the question.
Okay,
And
what advice would you give to individuals who are maybe watching this episode who lost hope, like they felt like, I tried everything, and they may face, some mental health challenges, but they maybe be open for some alternatives, but they want to hear,
so when
yeah.
you say tried everything, are you talking mentally, physically, or both?
When people say I tried everything,
Hmm.
like that obstacle of like losing, lack of hope.
Hmm. Lack
But
of
we don't know. I'm leaving this open for you. however you want to
Okay.
take it.
All right. So
Both side, it could be both, one side, whichever.
So yeah, I've tried everything. Oftentimes when people come into a psychiatric office to see a psychiatric nurse practitioner like myself or a psychiatrist, they've tried everything because they know in our healthcare system, if you go see us, you're going to leave with a pill. And that's not always the thing that you want. So they really come to us at that point that I've tried everything. My hope and goal is to help expand the things you can try and how you can look at things before you can see me. And then also, I want you to know that coming to me, you're not going to be medication first. It doesn't guarantee, seeing me wouldn't guarantee you're going to get a pill. Although they're used as needed, it's just that in our society, they're used for everything. They're overusage of medication. And then when it comes to just overall wellness, where we've tried the diets, we've tried sleeping better and the supplements and the walking and the exercise, and you're still not getting results, I get a lot of, I've tried everything there. But the one thing that's missing in the trying everything is understanding how your body works. And that's why I love the functional genomics, understanding the DNA, because we follow the trends that everybody else is getting success, and then don't understand why we only get so much success and then it stops. And one of the things with that, talking about overall wellness and diets and trends, is the most important thread between all of the diet trends is that you get rid of the stuff that's putting on the weight and making you feel bad in the first place. You have to get rid of the fried foods and all of these other things. But then now, when it's time to really eat something healthy, you can eat something healthy that doesn't work for you. And that's where you really need to know what you eat. So you're eating according to you, because you can be causing inflammation in your body because it doesn't process it, or doesn't know how to utilize it, even though it's healthy. So the sweet sauce is that DNA, knowing how you work. That's just the key to everything. When you've tried it all, have you've tried it all, but you've tried it based on general guidelines for everyone and not specific to you. And that's my goal, is to spread that specificity to the personalization and customization to you.
Thank you for sharing that. Is there any case of your patient would you feel like it's important to bring, as we're landing to the end, some
Mhm.
story of someone who, story which might bring hope to people, where, somebody walking to your room, your
Yeah. So
office. Yeah.
I shared with you about the guy that thought he had ADHD, you know, done everything. Dad has it. So there, genetics right there, right? Dad has it. I must have it. And through our approach, we were able to address that by getting to the root cause. I had another client come to me that has been experiencing severe mental illness all of her life, lots of trauma, always been on meds. And she came to me and said that, I'm having increasing symptoms. I want to increase my medications because I'm just feeling worse and worse and worse. And I'm like, okay. So what I end up doing, I did a functional test and come to find out that her environment was filled with mold. And so that was the root cause of what was going on at that time for those symptoms to erupt. But then, with further DNA testing, we optimized her body. She got out of that situation, was able to heal, and now she's on the least amount of medications that she needs, and her body is functioning well and now feeling the best she could ever feel. So that is the power in getting to the root cause of what's going on. Instead of, again, spending a life increasing medication, switching out medication, trying this, trying that, we get to the root cause, optimize the body so you can live your best life. And it takes out so much time in your life so that you can really be living and doing the things you really want to do and not being in the healthcare system or the doctor's office.
I love your wisdom and how you bring, everything together, and the drugs, the pharmacology as the last, which we all know it's kind of driven by the system, and that's why it's so common prescribed. And
Hmm.
so many people might not even know there are options. So I'm glad we get to talk about it. And what's the role of functional psychiatric nurse? Like we met, a week ago, and I didn't know. I would like to ask you the definition. What psychiatric nurse practitioner does?
So, a psychiatric nurse practitioner is the nurse form of a psychiatrist, right? So, we know of a psychiatrist that's the medical doctor that specializes in treating and assessing mental health. So, my training began as a nurse, a registered nurse. And then from there, you can advance your education to become a provider, which is a nurse practitioner. And then the nurse practitioner can specialize in family medicine, psychiatric, mental health, and we're board certified, women's health, and the gerontology population. And so we have that specialty. So now we are a provider. Uh, and the cool thing is that you have your medical doctor, but a nurse practitioner, what I love about being a nurse practitioner is I was a nurse first. And what that means is I was in the hospital with you when you were at your lowest point, when you were spilling your guts out, when we would give you the meds that were ordered and we saw the results of what you were given. We saw how you managed what was going on. And then even being in case management and home health care, you see how people are managing their health in their home. You see what the coordination of their health care is. And so there's so much knowledge about a day in the life of a person with a health condition that a nurse brings into being a medical provider that I think just surpasses everything. And it brings just that level of humanness and advanced knowledge that no one can replace. And I think that's just what makes nurse practitioners amazing because we know as a human being what you've gone through in the healthcare system. But a psychiatric nurse practitioner assesses, diagnoses, and treats mental health conditions and issues, just as similar to a psychiatrist. But I wanted to do more than writing prescriptions or recommending counseling. I felt that it has to be an approach that includes everything about the person because mental health is everything, and everything is mental health.
Mental health is everything, and everything is mental health. I feel like that will be one of the shorts I'm going to do out of this interview. And it all, thank you for sharing that and educating us because I feel like we might, as a society, don't give enough credit to this occupation and all what comes with it and all the years you have had to spend first doing the nursing school. And
Mhm.
I mean, how many years? Yeah, it's like how many years has it
You
has?
could take it up to almost 10. It
Uh,
is a lot of years, the bachelor's, the master's, and you could stop at a master's with a nurse practitioner.
mhm.
But our profession is encouraging us to continue on to that doctorate. And so you're seeing more and more doctorally prepared nurse practitioners. And and one thing, so I have a DNP, a doctorate of nursing practice. And the goal of this doctorate is so that we can take the evidence, the science backed evidence, and bring it into the healthcare system quicker, sooner, and put it in place because it takes a long time for research to catch up with actual implementation in our healthcare system. And that's one of the beauties that we bring is we bring that evidence-based practice into healthcare sooner at a doctoral level.
Mhm. Wow, thank you for that as well. That brings more to the table and educates all of us. And also, I just want to conclude, summarize all what you shared today and how that I hope is going to leave our audience feeling more in control of their life and health and how much they can do
Hmm.
uh, through their choices. All 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 of what you beautifully shared. Is there last words you want to conclude, share, add, now is the time. I will make sure to attach all the links.
Well, I would just love to empower and encourage everyone to do everything you can for your health, to live your best life. We all have these goals and these visions, and I'm here to say that they are very attainable. You just have to be open to receiving the answer and moving towards them. And it is there for you. Also, I want to relieve and take off a lot of the pressure that we put on ourselves, whether it's traditions, whether it's what we think, or what others think. Take those pressures off. When I talk about getting rid of those things that no longer serve you, it can be some of those things, those pressures and beliefs and traditions that we put on our shoulders. Like I said with the moms, she has to be a superhero. She can't have, if you ask for medication or help, you're weak, things like that. Take all of that off of your shoulders. Get in alignment with yourself and live your best life. I'm here to help in any way that I can. So feel free to reach out. I offer free discovery calls to talk about where you are and what you're doing. And then I'll also give you the link where you can do that functional genomics DNA test and learn how your body works to help you figure out that plan for you to achieve maximum mental and physical health and well-being. And follow me on social media, Dr. Tiffany M. Smith, at Instagram, LinkedIn, and Facebook.
What else? What else?
And that's all I have for right now. You can visit my website, and then I'm all over the internet doing guest podcast speaking, writing articles, things like that.
Wonderful. Thank you, Dr. Tiffany Smith. It was a pleasure. I learned so much. I hope our audience as well. Check out the links below, and you all have a wonderful day, night, wherever you are in the world. And yes, exciting journey. Thank you.
Thank you.
I hope you enjoyed this interview, and please subscribe my YouTube channel. For you, it's a one click. For me, it means the possibility to continue creating impact in the world with those videos. Thank you, and see you soon.